I want to welcome our webcast audience, in particular, to our work here at the Global Forum. Some of you are perhaps just joining us now. Some of you have been with us longer. It's been a fascinating day and a half looking at the variety of ways we are envisioning our future, from the greater use of community health workers to technology to actually focusing in on those huge factors in health and well-being that are the social determinants of health for people, frankly, at all social and economic groups. And most recently, looking at our linkage to the animal kingdoms and the ecology and the important role that's going to play going forward, and how we might be working that into our curricula. It's been a fascinating couple of days so far. What we have ahead for this next stretch of time are some presentations from members of the forum or organizations linked to them that are focusing on specific programs in different areas for developing a future that we would like to be seeing coming forward. It's a very diverse group, and the kinds of programs you'll be listening to here will reflect some of the diversity of the larger discussion. Each is going to have 6 to 8 minutes to present, a short question and answer period, and I think that's plenty of overview introduction. Our first presenter is Björg Palsdottir, close enough, who is, and now I will need to switch glasses here. She is the co-founder of the Training for Health Equity Network, and she's going to come up first to speak and present from the podium. So, you want to come up?
Good morning, everyone. What makes a good school? How do we, in the US, you talk about Ivy League school. Is it many grants they have, faculty that's distinguished? Is that the right way to measure the education or the quality of the education that you receive at an institution? Well, we think not. And there's lots of groups out there that are starting to think that maybe we should measure success differently. And maybe it should be focusing on whether these institutions are doing the research and training the kind of health workforce that's needed for the future, that is willing and able and ready to work wherever it is most needed. I'm going to speak to you a little bit about a small collaboration of schools that are really thinking about these issues, and they're located across high and low income countries, as you see, and they are specifically working under a social accountability mandate, basically meaning they're trying to address the needs of the communities that they serve. So what does that mean? Actually, a lot of this, what we've been discussing in the last couple of days, is how these schools are thinking. To these schools, community engagement is hardwired. It's a part of the DNA. It provides information on who gets selected. Communities participate in communities, and actually one of the speakers that's coming after me, his school is a member, and they actually involve students in developing the curriculum as well. So it's about participatory approaches. It's learner-centered. It's about how do we provide the kind of learning that people need to work in the context they're expected to work in. And it's integrated. It looks at the whole person, it looks at the whole community and society and these various factors that make the health of populations and people. It's proactive and it's adaptive. It's really looking at what is needed. It's constantly asking itself, they're asking themselves, are we meeting the needs? Are we actually not meeting the needs of today? But these health workers are going to be working in the health system for the next, like somebody said, 50 years. Are they ready? Embedded. Embedded means that we're looking at the health system holistically, from the home to the tertiary care hospital. If we only train in tertiary care hospital, how can we possibly expect health professionals to come up with the competencies that they need? team-oriented. We know it's not going to be one person that's going to solve the problem. It's going to be a team. And maybe the way to do this is actually define the competencies together based on what is key, which is the needs. If you start by defining the needs in the beginning and then back into it and try to hold yourself accountable for meeting those needs, then we think you're on the track. And this is not something that's already happened, and there's something that many schools have been doing for quite a while. So it just builds on a very simple framework, but although it's not simple to do. It's really looking at what are the health system, community, and student needs. You know, what are the competencies and attitudes needed to meet those needs? Who do we select? Who is our faculty? Are we making decisions within the institutions, or are we organizing our institutions in a way that's actually helping make our institution proactive and adaptive? How do we deliver the education and research and services needed to meet the needs in our context? And then constantly evaluating, looking at what's working, what's not, and actually try to hold ourselves accountable to outcomes. Outcomes in the students, outcomes in the graduates, outcomes in the communities that we are serving. And again, going back to looking at it, because it's an iterative process. By the time, if you think you're there, you're probably slipping off. So what does the Training for Health Equity Network do? It started as sort of more as an informal network of collaboration, because what was interesting is we found that in these schools across the context, they actually share some strategies. So we started by developing a framework looking at what we thought, based on these successful experiences, are the main factors that will produce institutions and health workers that meet the needs of whatever society they work in. What we also try to do is to share the resources, and we're currently working on developing a social accountability toolkit for institutions. But this, as we've heard in the discussion, this is an evolving practice, and one of the things that we're wanting to do now is really reach out to partners so we can actually together help build the case. Another thing we do is evaluate impact. We've been asked by the US government to look at a large program investment in health workforce education, both in medical and nursing education, and look at the impact on health and health systems. We do collaborative research. We try to build from the experiences that's going on in our countries, but also try to foster collaborations around looking at specific topics. And then we advocate and hope to shape policy. But most importantly, we believe in partnerships. We're a small organization. We are looking at one piece of the puzzle. We can only do this in collaboration with others. And so here are just some of the partners that we have worked with, and there are others there. But for example, the Network Towards Unity for Health is another partner. But we're also wanting to work with this forum because it is a hugely important topic, and we believe that schools really need to be at the discussion table when we're setting policy. So this is just a brief overview of the current research we're doing. We're looking at graduate outcomes. We're looking at, over a 10-year period of time, who do we select into the program? What career goals do they have in the beginning of the program? And then what do they do at the end? And then down the line, 5 years, 10 years down the line, are there actually, what has changed? And then we have qualitative studies looking at what changed, what were the key factors. And then we also have, because all of our schools actually, or most of them, they have targeted recruitment. They tend to try to recruit from the communities that have the greatest needs, or at least reflect the population of the societies that they work in. So it's important to understand how that impacts where they work and their career choices. We have a small study on the 2 schools that we have in the Philippines, really looking at health impact, because we know that in both areas, both maternal and infant mortality has gone down. We want to understand how they contributed, What were the key elements? So it's a very exciting study. Return on investment is something we've been talking about, because ultimately, if we want to change, we have to make that financial argument. But return on investment, not just in terms of dollars, but in terms of what do you gain by, for example, providing an opportunity for people that otherwise would never dream of coming into a health career? What kind of benefit is that? What kind of benefit is that you actually, for example, train primary care providers where they're most needed, rather than having to import from the outside? What about turnover? What about the impact, and we've seen that at some of our schools, real impact, economic impact, by having the school embedded into the health system in rural and remote areas or urban poor communities. We're also looking at the quality of graduates. So just to remind us, our vision for the future is that education and service delivery become very closely linked, and very closely linked with the work of communities as well. We need to be much more flexible, and we have to focus on health, keeping people healthy, but also making sure that everyone not only has access, but is able and takes advantage of quality healthcare services. So it's a short presentation, so if you want more information, here's our website. But I also would love to ask you to, if you're interested, to check out on YouTube. There's some very interesting videos, including this one. But it's 20 minutes, so I couldn't provide it. It would have actually painted a much greater picture than I could ever say in a few words. But it's called The New Breed of Doctors. It's from one of our Filipino colleagues. So thank you very much.
I think we have a chance for a brief follow-up question, and I'm wondering if you have, I know you've got outcomes as a focus, and I'm wondering if you've got data to share at this point.
Well, there's actually several studies that have been completed, but also a lot that are underway. We've tried to, because we're thinking longitudinally, we know that in terms of retention, we know particularly the most impressive results are actually in the Filipino schools, which tend to be net exporters of health workers. And they have 90% retention in country, but more impressively, they actually, with some variation between the schools, they have over 80% retention in the disadvantaged region that they serve. We're also, and actually if you go to our website, you can look at some of the studies that have taken place around, and Dr. Damasen spoke about what they've increased, for example, the production of primary care physicians. So there's lots of results to look at. So I would send you to our website to see more results.
Very good, thanks.